from the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
You know how long it's going to be about
I'm not quite sure how long it's going to be.
Oh, I can't wait to see you in person.
Yeah, me too, but I want you to know that I'm with you all the time.
Pretty soon, I hope this quarantine will be over.
Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, COVID-19 Senior Living Communities. Here to talk more about it is Becky Wiesel. Becky is an interim deputy director for the Nebraska Department of Health and Human Services. Thank you so much for being here and welcome.
Thank you for having me.
You bet. I want to start by asking you, how many licensed assisted living and nursing home communities do we have in the state of Nebraska?
We have 206 nursing homes in Nebraska and 286 assisted living facilities that are licensed.
Okay, which translates, Becky, into how many residents?
Typically, we do not track the number of residents, but we track the number of licensed beds in the facilities. Now, for nursing homes, we have 15,583 licensed beds, and for assisted living facilities, we have 13,290 licensed beds. Recently, we did a survey of nursing homes because of a new initiative for testing in those facilities, and we do know that there are approximately 12,000 nursing home residents currently in Nebraska.
Tell us a little bit about the men and women who are living in those communities, Becky.
They're all of our family members, our grandparents, our parents. Assisted living folks are people who just need some assistance. Assisted living is more of a social model to it, where the residents have independent decision making about the care they receive, either they or their family members, if the resident is not able to make that decision on their own. But in a nursing home, residents require a higher level of care. They have a greater need, and not only is the resident involved in their care decision, but also their medical provider. And so it's based on more of a medical model in a nursing home.
Okay, and regardless of where they're coming from, many are seeking that sense of purpose and well-being in what we hope is a safe and secure environment, one that they've been assessed to be a part of. Talk to us about that sense of purpose and how important that is at any age, really, but really for the purposes of this program for the older adult.
Well, residents are in facilities based on their level of need, of course. And some people choose to live in assisted living just to have a little additional assistance. But I do know that the folks who run the facilities, administrators and the staff who run those facilities, try to make residents as comfortable as they possibly can because it is their home. And you want them to feel as though they're still living in their home so that they could enjoy the years of their life that they have remaining.
Okay, thank you. Tell us about your role, Becky, with the Nebraska Department of Health and Human Services. What are you doing there?
Okay. I am within the Division of Public Health, and I'm one of 3 deputy directors. Actually, I'm an interim deputy director at this time. And my area that I oversee is health licensure and environmental health. And I've been the administrator for the licensure unit for a number of years. And our role is public protection. Our healthcare facility licensure teams go out and do inspections. We call them surveys of facilities in Nebraska. And the primary purpose is to ensure resident safety and patient safety.
Okay, so when news of COVID-19 was coming down the pike, having said all of that, what was going through your mind?
Well, we knew how vulnerable residents are in these facilities. Many of these folks already have compromised health conditions that put them at a much greater risk of contracting COVID-19 and making it more difficult to treat those individuals. So we began thinking about all the things that would need to take place to ensure that their safety was maintained. Things like, how can people go into those facilities and visit their loved ones? Just about the activities that these folks could engage in during the day. Because any time that they would be interacting with other individuals, they have risk of exposure.
Okay, other risks that come to mind, and you've brought up some really good ones, but were there any other things that you were thinking about in terms of that safety piece for them?
Well, much of the guidance that we follow comes from the Centers for Medicare and Medicaid Services, and that's known as CMS. And so facilities in Nebraska can be state licensed, which assisted living facilities are state licensed only. They are not regulated by CMS. And then nursing homes can be both state licensed as well as certified by Medicare and Medicaid to participate in those federal programs. So our goal was to implement the guidance that CMS was directing for those facilities. And from the beginning of COVID, because we felt both populations were vulnerable people, even though CMS does not regulate assisted living facilities, we consistently applied those same principles when managing COVID in both types of facilities.
Okay, so you're thinking, you're planning. What is step one when you go to actually act in terms of making sure that you're meeting your objectives? Thinking back, what did you guys do first?
It seems like such a long time ago.
I know.
And so much has happened since then. We did a number of things because there's so many people involved in the industry. But one thing that we have done from the very beginning is that we partnered with the professional associations for healthcare facilities, both Leading Age Nebraska and the Nebraska Healthcare Association. So we've been in collaboration with them in many of the things that we do and lots of meetings. We also have partnered with the ICAP team from UNMC here. And I always struggle with the acronym for ICAP, but it's Nebraska's Infection Control Assessment and Promotion Program. And those individuals are experts in infection control, and they've been instrumental in helping facilities identify areas of where they could improve on infection control to minimize COVID exposure in their facilities. So we've worked collaboratively with them. We did ongoing weekly webinars where we participated with the licensed facilities in Nebraska. And so we could have almost 500 facilities on a webinar and reviewing with them any new guidance that was coming out from CMS. And the guidance was changing so rapidly. We tried to help them interpret the guidance so that they would have a better idea of how to manage COVID in their facilities and how to remain in compliance with those state and federal regulations.
I can't even imagine how challenging that must have been for you, Becky. I mean, these are conversations you want to be having like this with people, not through technology, right? But do you feel you were able to reach these people in a way that was necessary at that time and that you still are?
I think all of us have adapted to communicating using technology. And while we struggled initially, I think over time we all became more comfortable with it. So yes, I do feel that we have been able to reach the folks who support the nursing homes, who not only the professional associations, but the administrators and the people who work, the staff who work in those nursing homes, to help them provide better care for the residents.
Okay, and I know management of something very, very important. There's a phasal approach that you took here, and folks can go to the website and find out all sorts of detail about it. But what I'd like you to do is talk about the people who are sitting around the table. And I want to do that first, and then I want you to break down each phase for us so that we have a better understanding of big picture, how you were looking at this and trying to effectively manage the situation. So who was around the table?
Okay, well, within the Department of Health and Human Services, of course, we have a team of individuals who work in the long-term care office. And there's a program manager for long-term care, and she oversees a group of 36 surveyors who go out and do inspections and complaint investigations in those settings. So she was certainly involved. We have other individuals who've had a long history with long-term care facilities in Nebraska, so those folks were involved as well. And just a collaboration of people from the Division of Public Health, because it's always good to get different perspectives from other areas. And then, of course, the stakeholders that I described before, those professional organizations and facilities, were also involved in discussions about the phasing guidance, because we wanted it to be a useful document that facilities could use to help them transition to remove some of the restrictions that had been put in place.
Yeah, I heard you say the word perspectives, so incredibly important. How did you find that process worked, Becky? I mean, with that many people around the table, you're in the middle of a pandemic, it's not getting better, right? And so you're kind of, in some ways, racing against the clock, trying to figure out something somewhat in a hurry, but making sure that it's gonna come off, right? So how did you find that collaborative piece to really work to get to your end goal?
Well, I really feel like it was an open environment where no idea was off the table. We were willing to consider anything, and we wanted everyone to feel as though they could make any suggestion that came to mind, because we were really hoping to find something that would help the residents be able to return to somewhat of a normal life.
I'm asking this, I'm listening to you, and I'm asking it based on what you're sharing there. When you're sitting around a table like that, what is your source of inspiration? In other words, we're all on committees where we're serving a certain population, right? But maybe that population isn't represented in the room. So did you need to be reminded, have you worked in the industry enough that, that face was constantly coming to mind for you to help kind of drive you and drive the mission of what you were trying to do? Or was that just kind of there because of the backgrounds that you all brought to the table and the passion?
I think it's a combination of both, Kathy. Those of us who work in regulation of long-term care facilities do have a compassion for folks who reside in those facilities. And I know for me personally, my parents have both passed away, but I think many of us thought of our own family members and how put ourselves in the shoes of the folks who are having to visit through a glass or from outside the facility or using technology and not being able to hug your mom or kiss your mom. And so I think that helped put things in perspective.
Okay.
For us.
Yeah, and hopefully things in place. So those phases, and it's only a 30-minute program,
Okay.
but provide us, please, with a brief snapshot of each of those phases, whatever is important for us to know.
Okay, so we created this document of long-term care phasing guidance, and it was based off of guidance that was provided by CMS, the Centers for Medicare and Medicaid Services. And it was intended to be a very gradual transition from one phase to the next to help relax some of the restrictive measures that had been put in place to manage COVID in facilities. There were several considerations, such as visitation, that was a primary one. Communal dining was a big area, because for a person in a facility to have the ability to interact with others and share a meal is a very important thing. Activities that they do within their facility was another big thing. And so each of the phases made gradual removal of some of the restrictions in place, but yet kept precautions in place to minimize the potential for COVID exposure. And even if a facility has done an excellent job of keeping COVID out of their facility, it only takes one instance of someone coming in and it can quickly spread and infect to multiple people.
Okay.
So as far as the distinction between the three phases, I would say moving from phase 1 to phase 2, we did add salon services, and that was very important for the elders because many of them had not had a haircut or had their hair fixed for months. And so that was something new. Let me think. Salon services was also relaxed further in phase 3. But probably the biggest thing for phase 3 was more visitation, so that people would be able to enjoy outside visits outside of the facility with their families. They still had to practice social distancing and hand hygiene and wearing masks, of course, the universal precautions that they wanted in place. And in order for a facility to progress to phase 3, one of the criteria was the facility had to complete what was called baseline testing for COVID of all of their staff members. And if their facility had ever had a positive staff member or resident, they also needed to test their residents.
Okay, so that's the baseline testing. Now, that wasn't the only initiative. You had a second initiative, this one directed by CMS, and it is the COVID-19 infection control surveys. That was another step that was taken in order to minimize or reduce the risk. Talk a little bit about that.
Okay, CMS, it was probably mid-June, and CMS advised state survey agencies to complete a focused infection control survey on each nursing home within their state. And there was a very short time frame. We had to have all 206 nursing homes inspected for this infection control criteria by the end of July. And we were able to accomplish that. But because infection control is so important in mitigating COVID, that's why they wanted to focus on how facilities were doing with infection control.
Wow, and you said you did get it accomplished in the amount of time. How? Becky? Did you guys sleep at all this summer? Or, I mean, honestly, that's quite an undertaking when you go back to the beginning of the program when we were asking about the number of communities out there. This is no easy task. How many folks did you have involved with that?
Well, I did mention we have 36 surveyors in the long-term care office. And initially when COVID began, CMS suspended survey activity except for immediate jeopardy complaints, which are a very serious nature, or any complaints that involved infection control. So many of our surveyors had been working from home, doing other kinds of activities to perform their work, but they weren't actually going out and doing routine inspections. So when this came down that we needed to go out and do the focused infection control surveys, we pulled all of our teams back. First of all, we had to get them all fit tested for personal protective equipment because, of course, going into a COVID positive setting, we had to protect our staff. And so they had to be fit tested for the N95 masks, and we had to ensure that we had an adequate supply of PPE to protect our teams. But I can't say enough about the tremendous effort that these teams put forward because they are putting themselves in harm's way, but that's the job that they do. They do this because they love the long-term care industry and they love the residents who live in those facilities, and they want to make sure that those environments are safe.
Yeah, I'm glad we're addressing this today because I think for so many of us, I'll go back to your word perspective, we see it from our own vantage point. And we're kind of losing sight of all that's going on behind the scenes in terms of some of the things that you've described. There's another initiative I want to hit, the routine testing initiative. Can you talk about that a little bit, also directed by CMS?
Yes, that's come out more recently within the last couple weeks. And CMS is now asking that, requiring that states' facilities do routine testing of their staff. And it's based on the county positivity rate for COVID. And if a county where a facility is located, if the positivity rate is above 10%, CMS is requiring that facility test all of their staff twice weekly, which is a lot of testing. And if their rate is between 5 and 10%, it would be once weekly. And if it's under 5%, it would be once monthly. And so facilities have been trying to identify ways to meet these requirements. Part of what CMS did was to send out something new, a new kind of testing called point of care antigen testing. And 188 of our facilities have received these antigen testing machines that you can do the testing right there at the facility and have a more immediate result with that test. They are still, if there are situations where you have to do a confirmatory test, and so our Test Nebraska system that we had used for the baseline testing is still being offered for any of those confirmatory tests.
Okay, I think viewers will be relieved and pleased to hear that that's going on, because I know, especially in the early days, as we were trying to get used to the window visits, we're seeing the staff come and go, as they'd like. They're going home, they're going back to their regular lives. We're all doing everything that we can to stay healthy because we don't know when we're actually going to be allowed in the building. And so I think that was a frustration, again, especially for those people who are visiting. So I'm glad to see that that's in place for that reason, but also for the staff's safety. And I don't think we talk enough about the staff and what they've actually endured through all of this. Above and beyond doesn't even begin to describe what they're doing. But Becky, as you're talking about the testing, and let's say staff members are tested positive, I mean, this industry is one that somewhat struggles sometimes to find the right people, and turnover has been talked about. What are you finding right now in the midst of COVID? Do we have enough people to cover what needs to be covered for our older adults, do you think? Are people hanging in there? And if they're not, are other folks coming into the rescue? What's your sense on that?
Well, it is challenging because people are exhausted. It's been a long time, and many of the staff, I believe, from what we're hearing, are frustrated that why do we have to be tested so frequently? And it's not a pleasant experience. I've not been tested myself, but I've understood that it's not a pleasant thing. And if you're expected to do that twice weekly, that can be a burden. So the concern now is we don't want to have a shortage of people to be working in these facilities to care for the residents. And so that's our current dilemma.
Yeah. Any recruitment going on that you are aware of or that you're needing to do, or are you just trying to get through day by day?
Well, I know that I was just at the Healthcare Association yesterday, and they are still having people attend their classes to become nurse aides and medication aides who work in these facilities. So that was encouraging to me that there are still people who want to enter that industry.
Okay. Greatest lesson learned to this point, Becky, what would you say that would be from your vantage point?
Wow. I think it's going back to that putting yourself in the shoes of those families, the residents themselves and their families, because it's one thing to sit in a meeting room and make decisions and give guidance and make regulations, but we can't lose touch with the personal end of things. And while I think we did a good job of that, we can always do better.
Okay. And final question. For those watching, both the older adults and their families, light at the end of the tunnel, how much longer? What would you say to those folks?
I feel badly, but I don't know how much longer. We're hoping that things will improve. I know that they're working on vaccine, and hopefully that will make a difference as well. There is recently issued guidance from CMS that just came out the end of last week that will make a difference even further in the visitation. But again, I think we all just need to be vigilant with distancing, hand sanitizing, wearing masks, and doing what we can to protect those who are most vulnerable.
Thank you. I want to put up a website and a phone number for people wanting more information about today's program, COVID-19 Senior Living Communities, talking to Becky Wiesel. It's dhhs.ne.gov, and you can call this number, 833-998-2275. I want to thank Becky for joining us today, for sharing your time and expertise and stories. Please keep doing what you're doing. You guys are amazing, so thank you.
Thank you, Kathy.
And thanks to our students working so hard behind the scenes, and of course to all of you for watching. As we close, a look at scenes from Walnut Creek Recreational Area and Papillion, as seen through the lens of Dakota Bachman, a junior, right here at UNO. We will see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at netnebraska.org/Consider This. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.
The University of Nebraska at Omaha's bookstore is home to more than books. The UNO bookstore accommodates all students' needs with phone and laptop repairs at the iFix UNO station or free residence hall delivery. The bookstore, located in the Malabale Student Center, is full of Maverick merchandise. Find sweatshirts for chilly Nebraska days or cozy UNO mugs for every coffee fix. Shop anytime at unobookstore.com.